Vitamin E is important for the eye health in children and adults. Vitamin E is also important in the development of a fetus, specifically the heart, ears, eyes, and limbs. It can reduce carcinogens for certain types of cancers, particularly breast, liver, colon, and prostate cancers. Vitamin E is already being used to treat skin disease like psoriasis and acne. And the retinitis pigmentosa, it also can be treated by vitamin E, which is a progressive night blindness and loss of peripheral and central vision. You can get most of the vitamin E that your body needs from healthy food that contain vitamin E, like liver, fish and fish oil, milk, eggs, dark fruit, leafy green vegetables, orange and yellow vegetables like potato and carrot, tomato product, some vegetables oil, and eating food that are fortified. But be aware, taking more than the recommended daily allowance over several months can cause vitamin A toxicity. And this condition can occur more quickly in children and infants because their bodies are smaller. Vitamin E is a generic term for a number of compounds like retinol, retinan, retinoic acid, and a large number of carotenoids, and beta-carotene, which is known as performant vitamin E. Vitamin E in the form of retinol plays a vital role in vision, specifically in the ability to adapt the transition from light to dark. The inadequate amount of retinol in the retina, it results in what is known night blindness. Vitamin E also plays a role in maintaining a healthy immune system. Vitamin E deficiencies. Vitamin E deficiency is the leading preventable cause of childhood blindness, and the mild vitamin E deficiencies can cause dry eye, corneal ulcers, and scarring, and also can cause disease of immune system and respiratory and gastric illness. The excess amount of vitamin E are stored in liver and it accumulates over time. And this toxicity is caused by taking high-dose dietary supplements. This is maybe because of megavitamin therapy. And megavitamin therapy involves consuming of very large doses of certain vitamins in an attempt to prevent or treat diseases. Symptoms of vitamin A toxicity. The toxicity may be acute or chronic. Symptoms of acute vitamin A toxicity include drowsiness, irritability, abdominal pain, nausea, vomiting, increased pressure on the brain. Symptoms of chronic toxicity of vitamin E includes bone and muscle pain, loss of appetite, skin disorders, headache, dry skin, hair loss, increased liver size, vomiting, and visual disturbance, which is reduction in visual acuity, blindness to red-green color, optic neuritis, and these changes are reversible on stopping drug. And also, the high intake of vitamin E can cause osteoporosis and hyperkeratosis. And the excess take of vitamin E during pregnancy can increase the risk of fetal abnormalities developing. It can affect the eye, the skull, lungs, and the heart of the baby. And there is other potential complication of the excessive amount of vitamin E, which includes liver damage, osteoporosis, and the excessive calcium buildup in the body, and kidney damage due to the excess of calcium. How to treat vitamin A toxicity? The best way of treatment of vitamin A toxicity is to stop the taking high dose of vitamin A supplements. And most of people make a fully recovery within few weeks. And any other complication like kidney or liver damage will be treated independently. And there is another treatment called phosphatidylcholine in the form of PPC or DLPC. If the liver is damaged, you have to stop immediately taking vitamin E. And liver transplantation may be a valid option if no improvement occurs. Vitamin E may elevate hypervitaminosis A. So, if you have any symptoms of vitamin A toxicity, you should stop taking both of them. The aim of this video is to explain how vitamin A in high doses can be very dangerous. So please try to get your vitamin A needs from natural sources or from supplements, but in the correct dose. And please, before taking any supplements, you should see your doctor or consult a pharmacist and tell him if you are allergic to any substance, because vitamin A supplements may contain inactive ingredient like soy.